So, the book I'm reading, The Woman with the Worm in Her Head and Other True Stories of Infectious Diseases by Pamela Nagami, who's a medical doctor. I was reading the next chapter of the book, titled AIDS. Now, in the beginning, she was talking about the day that she thought she had been in contact with HIV. So, basically, she was having a HIV clinic, and she was with this tall African American guy who had advanced AIDS and Kaposi sarcoma. Now, in his leg, he had like several tumors because of this, and so she needed to figure out like if he can feel anything or not. And eventually, things weren't. He could feel it, but he couldn't necessarily like feel how sharp, for example, or how hard it would be. Mm-hmm. So eventually she just took a wooden tongue depressor, basically a wooden thing, and she snapped it in half, and she took like the spiky splinters, and she said, okay, so I need you to tell me if it feels sharp or dull. And she would poke in between the tumors, and constantly he would say dull, dull, dull. And then she even poked it hard too. And so eventually she took her finger, she's like, is there something wrong? Because like thinking about it, like as your job, everything is just habit. So when you think something's wrong, you don't really think. So she tried it on herself, but then the splinters went right through her skin, and she started bleeding. And then she realized, oh, wait a minute, if it went through my skin and there's some bleeding, because she couldn't really see anything. She was like saying, then maybe, because how do you spread HIV? You can spread it through liquids. So if she poked through the skin of him, the blood went on the stick, and then poked it back her. She just almost intentionally gave herself HIV. So eventually she had talk with the other doctors, put her in a room, they washed her hands a lot, put some alcohol. Now the where she got poked, it's basically disappeared, but her body's been breached. So they had a long talk about it. Her chances of having the HIV is like less than 1%. But if she is infected, her chances of living are almost 0. So yeah, it's kind of sad. And then later she kind of drifts off a little bit, because she starts talking more about how she wasn't even supposed to be at the AIDS clinic, and that she was just supposed to be in the emergency doing some more, doing some other stuff. Now, eventually, she was thinking about, I haven't really touched AIDS or been next to AIDS ever since my friend, one of her friends, who was named Henry, was ill with AIDS. Now, then she started going on, she was saying he was a gay oncologist in Connecticut, and they were good friends, but back then she wasn't really sure if he was gay or not, so they were just together, right? Now I'm not going to go into too much detail because it's not too important, but later she talks more about how he got sick and how it wasn't supposed to be good. And then she talks about another guy who she had, who also had like the same sort of like thing, same AIDS. And it was this one guy, like for some reason this the thing that he had, which is PCP, pneumocystis carnii pneumonia. The thing that he had, it was for some reason only showed up in gay guys or druggies, guys who were with drugs. And this was kind of the start of a quiet epidemic, because like not a lot of people knew about it, but if you were gay, for example, for some reason you would have it, and they wouldn't know why exactly, or if you took drugs. So eventually, going back to this guy, he was saying, I know you're going to pull me through this, doc, but because he thought he was way too young to die, the guy that she was treating. But clearly he was wrong, because he took drugs. This guy wasn't gay, but he was a druggie, because he took a bunch of drugs. his lungs have been collapsing and soon weren't enough to help air circulate. And so, just like everyone else, or most people, after like 4 days, he died on the bed. And later, it starts talking about how, like, all these people, they all, for some reason, one factor in their lives, they get sick. There's one factor that they do, but that one factor is sort of a mystery right now. But there's one thing for sure that they all have in common, like 100% sure. They have a low T cell, helper T lymphocyte numbers, or white blood cells. And usually in a normal person, they have close to 1,000. But with these kind of people, they had like less than 200. So this was really bad. Their immune system was like dropping, so you definitely know it's AIDS. But what's causing it is kind of bad. You don't really know. So later she talks about a couple of causes that she thinks it could be, like Candida albicans, which is a minor vaginal yeast infection. But thinking about this, and also it kind of patches their throats and it's uncomfortable because there's white patches of it. And then exotic fungi such as Cryptococcus, which was rare, kind of invades their brains, but it's not necessarily that one either. So she keeps going down the list like any good doctor. Then Kaposi's sarcoma, she thought of that one. But then again, it was a rare tumor, and the tumors only appeared in the legs of old men. Now, our friend wasn't that old, so it wasn't necessarily that either. And then she was trying to think, these patients had, like, aggressive tumors, like lymphomas. But all these still trace to one problem, the helper T cells. And then eventually, researchers had advanced a bunch of theories and eventually got to one thing called poppers, or amyl nitrate. So basically, in the gay community, this was something that you popped and you took a whiff, and then this would help them get orgasms or something like that. And hence, that's why the druggies also got them too, got the same like problems. And then eventually, they realized, wait a second, this is not good for them. So, and I'm gonna quickly wrap this up, but on this like one good quote that she said, which I thought was very nice. One of the satisfactions of working in infectious diseases had been the sure knowledge that with the cool heads and a fund of information, we can diagnose difficult cases and then offer a cure. In what other specialty could the doctor say to the patient, "I'll clear up this infection, and in a week you'll be as good as new"? I thought this was nice because, like, being a doctor, you can always find what's wrong with the person, you give any medication, you do whatever procedure you need to do, and eventually they will be fine. And this satisfaction, kind of the same satisfaction, like, if you do something good behind, like, even though no one's watching. I mean, obviously someone is watching during this, right? You're saving someone's life, which is even a bigger help that you're doing to this person. So I thought this was nice. I'm going to end it there, but yeah, so far I'm currently inside the chapter, but yeah, that's basically it.